Yes, so I think that the CARD study is really a very, very well-designed study in a situation that we encounter a lot with our patients, that are patients who have had one line of chemotherapy, docetaxel, and one of the novel endocrine agents, abiraterone and enzalutamide. And we know it's quite some time that most patients don't really respond very well to the second novel endocrine agent. And so I think it was a very, very worthwhile third-line study, and that's one of the this is the first third-line study that's randomized and prospective in metastatic castration-resistant prostate cancer. So that's really amazing, and it's important. It's also generally in oncology, there's not that many third-line studies, and so it was very well designed. As I said, the patient population in the trial was also really very representative, what you see in your clinical practice. So I think that was very good. And the question there was, should you give the other novel endocrine agent, like a hormonal agent, or should you give the second chemotherapy, cabazitaxel? And the outcome was very clear. So the primary endpoint was radiographic progression-free survival, and that was clearly improved. And what is really fantastic also, the overall survival, what was the secondary endpoint, but was also improved. And again, this is like the first prospective trial in that situation showing that. And I think for patients really important is also the pain response was much better with the cabazitaxel. So I guess we have to, I told it, resist chemophobia, because it also seemed very well tolerated from what Ron DeWitt was showing us in his presentation. So there was not more toxicity in the cabazitaxel arm than in the enza or abi arm, depending what the patients had before. So in general, I have to say, yes, this is going to be the new standard for third line for patients who are chemotherapy fit. As I said in my discussion, now the question obviously comes, so what are we doing with the patients who are not fit? What are we doing with the patients who are really, really good responders to the first novel endocrine agents? Because they were excluded from this study. And I think there's new research areas that open up for us. But this is a big step because, again, first time we have overall survival benefit and radiographic progression-free survival benefit in a third-line population.